I'm very happy to have here today Dr. Stefano Pompei. His name suggests he's Italian, and he is, but he's not practicing in Italy. He's practicing in Dubai, and we want to hear about him and his interesting journey in plastic surgery and in the world. So, Stefano, thank you for coming here.
Thank you for the nice invitation for this.
And thank you for coming, providing us medical education and visiting us, and we're very fortunate. How is the COVID situation in Dubai?
Well, Dubai started right away with a very good campaign in terms of vaccination. It's for expats, for local people, whatever. So almost all the population is already vaccinated. But Dubai lives of tourism. So that's why we have to stay quite, cautious in the sense, because Expo, you can imagine how many millions they expect in terms of people going to Dubai for the Expo. That's why the situation is really under control.
How much percentage of your patient population are tourists? Is there some?
Yeah, the health tourism in Dubai is something that is growing slowly every year more. Coming from any kind of country of the Gulf, but having expat, is a mixed kind of thing coming from either other countries. That's why.
So you grew up in Rome, right?
Yes.
But where'd you go to med school?
The med school I started in Siena.
I
super
love
nice
Siena.
city. Yeah,
I love Siena.
That's why because my mother was from there, so I had my first 3 years in Siena.
Toscana.
Yeah, in Toscana, and I am half Tuscan, Tuscany guy. And then I stayed for many years in Rome. I finished my studies. I did my residency in plastic surgery in Rome at the Cattolica University at that time. And in Brazil, 3 years of my residence there.
Wow!
Yeah.
How'd you get to Brazil?
Yeah, because at that time they have a very good residency programs. So we had a possibility to dedicate myself. Then the full time it was a very hard period in terms of work, but it was amazing experience.
And who did you learn from in Brazil?
Well, that's at that time. Being popular, you can imagine in the middle, end of the 80s in Brazil, even the cosmetic surgery was exploding. But none in Rio de Janeiro.
Okay.
I worked at the hospital of the facial defect in São Paulo.
Okay.
It was a traditional, very important school for all the reconstructive procedures in kids. And not. I started with palate and cleft lift, and then the evolution.
Classic reconstruction work.
Yeah, at that time.
So how did you get to being a breast surgeon, reconstruction aesthetic? Where did you do your fellowship?
Because after that, I had the opportunity to stay at the Cancer Institute in Rome. So that's why breast was my initial important field to develop our specialty. So we started, even with flaps at that time was a typical tram flap and for breast reconstruction, and then evolving in microsurgical techniques for head and neck reconstruction and breast.
So when you grew up as a resident and as a fellow, which plastic surgeons did you look up to? You said, I want to be like them.
Well, that's having a different possibilities going around. I had a different masters. We can say that people that you can trust on. Yeah, exactly. So someone for micro, someone for dedicated for facial, cosmetic procedures, some for breast. So we had the big lucky life in this sense from the professional point of view, having the possibility to interact with different upper level specialists.
Now you're actually dividing your time between Rome and Dubai. How did you get to become a plastic surgeon in Dubai?
Yeah, because after many years having so many friends and having contacts everywhere from being speaker for many years going around the world, I had this nice proposal in Dubai. So, and Dubai is not so far. Yeah. If you are used to work in other countries, 5 hours flight is compatible with us. Working full time there because we have to follow up the patient very well, reconstructive and cosmetic. But at the same time, having my private practice for more than 25 years in Rome, I still have a group of my team that is taking care about the patient with there. So that's why I'm going back every 5-6 weeks. That's my time that I'm going back.
Cool.
Rome.
And what's the difference between the patients in Dubai and the patients in Italy?
Well, we have quite good differences in the terms. I mean, when we talk about, I mean, a European expat, for example, almost the same thing. The mentality is the same. I mean, with the rapport, with the relationship with the doctor and the patient is almost the same. But when you have local people, for example, the educational part between doctor and patient is really important, because the misunderstanding, if not, is quite possible. So we have to explain that plastic surgery doesn't do miracles. You cannot expect, for example, in an overweight situation or an obese situation to resolve the thing like this with some plastic surgery procedure, explaining all the risk of complication. This kind of attitude that you normally have less working in a European country. You have to take care about it.
So what are the kind of bread and butter surgeries that you do all day? Mostly half reconstructive, half aesthetic. How does it go?
Yeah, now actually even working at a Fakir University hospital, and that was a very good and qualified hospital in Dubai, as a multi-specialty hospital there. We have the possibility to collaborate with many amazing surgeons of the other specialty, with orthopedic, ENT, breast surgeons. So that's my reconstructive life, and that I can say, and emergency kind of things also. That's why. And the rest is dedicated to cosmetic surgery, working in different facilities there. That's mostly, in my case, being for the breast world, coming there is easy to receive this kind of secondary, more complicated kind of cases.
Interesting.
You know, and facial too, of course. Primary, secondary rhinoplasty, facelift, and then.
Nice. So you're most known for breast surgery, breast reconstruction, breast aesthetics.
Yeah.
But what surgery is your favorite to perform?
Can I tell you? Can
Yes,
I tell you the truth?
you can.
Yeah. So
I
rhinoplasty is, I think, is the best thing to do, because the most skill, the more anatomical detail, you know, the between the what can I say, indications and the skill for doing more precise kind of thing is really good.
You know who told me the same?
Yeah.
Per.
Oh, Per? Oh, you see?
He does
you
everything,
see?
but
And we
what
didn't
does he
talk
love
with-
the most?
I didn't talk with Per,
Yeah,
you know?
you
That's-
didn't
you
collaborate your answers?
see. Yeah, you see.
Okay, so you have a real passion for medical education. Where did it come from?
Well, you know, because having probably in my generation and having, once again, the possibility to work in other countries, you create, I mean, this kind of rapport with other colleagues, older people, that take care about you. That's really important. When they are really, they take care about your educational stuff. So you are able to evolve from the professional point of view. It's not an academic kind of, you know, distance, you know, this kind of stuff, because you're part of their life too, 24 hours a day. So that's why being a resident in this kind of facilities makes your professional life totally different.
Perfect. So tell me, what is your favorite music to listen in the OR, and does it change between Italy and Dubai?
Because I have some proposal working with international other colleagues. I mean, I have sometimes Indian music.
Indian music?
Yes, because I
that's
have,
good.
I mean,
I love
colleagues,
it.
nice colleagues coming from India into Dubai in the OT. So we have Arabic music.
That's perfect.
Sometimes, but when you have international thing, I'm happy. Honestly, yes.
You listen to some Italian music?
Yeah, of course. Yes, of course.
And what do you love listening to in Rome when you're working in Rome? Mostly international.
Easy, yeah, that's exactly. It's easy access for the international things. I mean, young people, they even in the OT, they prefer international music. You know.
So, if we exclude Israel, Dubai, and Italy, what's your favorite country in the world?
Well, you know, you exclude Brazil.
No. I did not exclude Brazil.
I love Brazil.
Yeah.
Yeah, that's it's an amazing place for living, and probably because I have so many brothers there, more than friends. That's why.
Cool. What's your favorite food? Italian, Brazilian, you've seen it all. Arabic, which is good food. What's your favorite food?
Well, you
or
know,
favorite dish?
Yeah, probably something that is genetical, because for Italians, I mean, loving the basic Italian Mediterranean food is the best thing. You have a very good simple things like bruschetta, like good pasta, like Tuscany kind of
cacio
pasta.
pepe.
Cacio pepe. peachy. That's a
Peachy, I
Tuscany
love Tuscan
kind
peachy
of
pasta.
thing. These basic things, nothing so sophisticated, but it's the best quality.
And in
of food.
Dubai, what do you like to eat the most?
Well, you know, in Dubai it's an international place. Whatever you like to find, you can find it.
Okay.
So it's up to you to choose.
Is there something that nobody knows about you? And you can tell us.
Well, you know, that probably the only I have a regret in the sense not being because of my educational kind of thing, the timing that I dedicated to my work probably if I would spend more time with my kids when I were younger,
Okay.
probably was something that create a better feeling now. That's
For sure.
It's a part of the life.
Yeah, it's a give and take. And one last thing, do you have a hobby? Like something that you like to do which is totally outside of plastic surgery?
Yeah, I'm a runner.
Runner?
Yeah, that's why I like running.
Every day?
For me, almost every day, and whenever possible.
How
running
far?
for me is a psycho kind of
How far?
kind of thing. I mean, that's not so much. I mean, not in competition, nothing with marathons or anything else, but at least 5-6 kilometers a day, and then some body weights. You know, this kind of stuff. But
Keeping
it's,
shape.
It's a part of
You listen
lifestyle.
to music or podcasts?
Oh yeah, it's music.
Music or podcast?
No. Music, whatever
Okay.
we have a possibility. The music important.
Perfect. Thank you very much, Stefano, for coming here.
Thank you. It
And
was a
first of all,
pleasure.
coming to Israel, and
Thank
second
you.
of all,
Thank you so much.
having this sit down with me. And I hope our residents will enjoy this talk.
I hope
And
so.
We hope to see you again.
Yeah, I hope so. It depends on Yoav to invite us again
I will talk to
in
him.
Tel Aviv. I have so many places to see in your country. We need more time for
Yes,
that.
yes, yes.
Thank you so much.